Good afternoon and welcome to our virtual town hall meetings. We have begun the process of opening these back up to the community after receiving a lot of questions that we continue to have come into City Hall to our different stakeholders and partners that you'll hear from today that will be of great interest to you. As always, this is the most up-to-date, accurate information that we are trying to provide to our residents in a way to keep them as safe as possible as we continue to respond to this global pandemic that are known as COVID-19. And first, we wanted to start off because a lot of the topics around some of the questions you'll hear us respond to today, obviously we continue to talk about mask wearing, why it's critical, why it's essential, and the city has put together a great informative campaign that will show many of our employees throughout the city why they think it's important to wear masks for our residents, for their neighbors, and we wanted to share it with you first and foremost today.
Hi, my name's Dave, and I wear a mask because it's socially responsible.
I am Benjamin. I wear a mask because I want to protect others.
I'm Lauren. I wear a mask because I want to keep us all safe.
Hi, my name is Kat, and as a liver transplant recipient, masks literally keep me alive.
My name is Kim. I wear my mask to support our community.
Hi, I'm Joe. I wear a mask because I love my wife and kids.
Hi, I'm Barb. I wear a face mask to be safe. Everyone should wear a face mask.
Hi, my name's Ashley Ann, and I wear my mask because I love my kids.
I'm Blake, and I wear my mask to protect my family.
Hi, I'm Virginia. I wear a mask for you and me.
Hi, I'm Brandon, and I wear a mask because of my family.
My name is James. I wear my mask because wearing my mask is cool.
Hi, I'm Brad. I wear a mask because you are worth it.
So obviously you'll hear throughout our hour of town hall discussion today of not only why it's critical and necessary for the mask wearing, why it does impact people's lives, but it is important for many reasons, in particular to our diverse population here in Palm Coast and Flagler County. So priority number one has always been within our community to keep our residents safe as we go through these unprecedented times, and we're glad to have everyone back assembled in order to be able to provide you information. So I'm going to turn it over, and first I want to recognize we do have a few of our regular stakeholders that are calling in remotely that you will be hearing from, and I'll do that introduction after I first hear from our health department. So we're grateful to always have Bob Snyder in the room with us, providing the health department update as the health department officer for Flagler County.
Oh, thank you so much, Mayor Hollins. So glad to be with you all this afternoon. Thank you. Well, since the beginning of the pandemic, we began tracking about 10 indicators to gauge the spread of COVID-19 in Flagler County and Palm Coast. Everyone knows that we're currently experiencing a surge of cases in Florida and in Flagler County. Total positive cases in Flagler was 850 as of this morning. This compares to 302 positive cases 4 weeks ago. Of the 850 for the county, 601 are from Palm Coast zip codes. Deaths related to COVID-19 total 10 for Flagler. The positivity rate for new cases the last 14 days is 7.1%. This compares to 1% just a few weeks ago. The workload for public health nurses and our disease investigators has significantly increased from about 100 positive case and tracing calls per day to 550 on Monday. However, two indicators are trending in the right direction. Emergency room visits for COVID-19-like symptoms began a downward trend the week of July 12th. and we sure hope this continues. Also, the RT value, which is the reproduction rate of the virus from an infectious person to another, is less than 1.0, and it is now 0.93. The lower the better for decreasing transmission, and Dr. Bickle is going to talk about this more momentarily. As with all the 67 county health departments, the public health strategy is focused on testing, tracing, isolating, and monitoring for hot spots, including nursing homes and other congregate care facilities. We are fortunate, everyone, to not have a major outbreak in our long-term care facilities. The caregivers in these settings should be applauded for their efforts in keeping our residents safe. Community testing has expanded over the last month. 12.12% of our county's residents have been tested. This week, the health department began testing at Cattleman's Hall at the fairgrounds Monday through Wednesday from 9 a.m. to 3 p.m. The health department established 5 additional testing sites, including Santa Maria del Mar Catholic Church and Flagler Beach, Mother Ann Seton Catholic Church, starting on August 7th, the First United Methodist Church of Bunnell, the Flagler Beach Pharmacy, and Church of the Rock in Bunnell. We are grateful to all of these churches and organizations for their support, and each site is operational on a separate day, with testing times later in the day to attract as many residents as possible. Because the percent of positive cases is high, the community spread of the virus is still a major issue, and we are just not catching those with infection quick enough to guide and to isolate them and begin that important contact tracing function. So we can expect additional community testing sites in the future, especially if outbreaks occur. Testing is by appointment, so please call 386-313-4200 to arrange one. And much, much thanks, everyone, to Jonathan Lord, his team, EMS and Fire Rescue, both city and county, our numerous volunteers for their command of the Daytona State College testing site the last 4 months. Remarkable job. One more word about testing. We're still experiencing slow turnaround times of up to 10+ days with a major lab. The demand for diagnostic PCR testing is just so great nationwide and in our state. To address this dilemma, the State Department of Health is contracting with 2 new labs that have committed to turnaround times of 2 to 3 days. So case investigation, contact tracing, and making hundreds of phone calls per day remain our priorities. We have received CARES Act funding to hire up to 40 additional staff to keep pace with these very important core disease investigation tasks. So far, 18 new staff have been trained and on board. Our other key public health messages remain the same. Facial covering when indoors, especially. Social distancing, hand hygiene, and avoid gatherings of more than 10. We appreciate the county campaign on mask wearing, especially the Pledge to Prevent initiative and the ordinances unanimously approved by all 3 cities to mandate mask wearing. This is a potential game changer, and we already have noticed greater compliance by the public. Thank you all for doing your part. So Dr. Bickle, take it away. Topic of the week. Explain to us what is meant by the RT value.
All right. Well, a lot of you have probably heard about this value. Sometimes they call it R naught, which is not technically accurate once the infection has started. R naught is like the baseline conditions for this, for any infectious illness. But basically, the R number refers to the reproductive rate. And the RT number is the reproductive rate at any point in time in any particular region. And the reason we focus on this is because it's basically the growth rate. It indicates, on average, based on the conditions present in an area at any moment in time, the average number of patients that one person will infect. And if you can imagine, if the higher this number is, the more rapidly the disease propagates. So if the R number is 1, What that means is that one patient will infect one other patient, and the disease will continue. It won't die out, but it won't grow. It doesn't mean that it'll go away. So it'll just mean the growth rate goes down to 0. Now, what that means in Flagler County is that, let's say we have 150 cases a week that we're diagnosing, and we get the R value down to 1, which is probably about what it is right now. It means that we'll continue to get 150 cases a week for indefinitely, which is not great at all. So it's a sign that we're not losing the battle in the sense of where things aren't getting worse, but it's also a sign that we're not really winning it, that we're kind of in a stalemate. And just to give you an idea how fast it spreads, I mean, we all know that, not too long ago, there were 10 cases roughly a week in the county. And Florida had, much lower numbers than it has now. And then, within 6 weeks of opening things up, the case numbers shot up. We went from 10 to about 150 a week, and Florida went to, 10,000 roughly a day. And when that happened at the peak, the R value was 1.47, which is pretty high. But what that means is through one cycle, one person will infect 1.47 people, and then those 1.47 people in the next cycle will affect another 1.47 people, which is already double. And then you do that a few more cycles, and then you're at 4 times. And then it actually, if you go through the numbers, you can get to 1,000. You can go from 1 to 1,000 in a month at the initial rate of how this thing was spreading. And then that 1,000 would go to 1 million in another month if no measures were taken to interrupt it. So hope that didn't get too technical. So basically what we're doing is we're in a battle with this, with this reproductive rate. If it gets substantially below 1, the case numbers go down, and they can go down pretty rapidly if we get way below 1. If it gets above 1, then the case numbers go up, and same thing, they can go up pretty rapidly. Florida went from 1.47 at its peak. The bottom was 0.93 recently. It's now 0.98. Actually, in the last couple of days. We don't have those numbers for Flagler County. Florida cases in the week 2 weeks ago were averaging about 11,000 a day, and now it's down to about 9,700. So that reflects about a 10% drop. Flagler County was 154 the week 2 weeks ago, and now 148 the last week. So we're kind of plateauing. But we need to get this R significantly below 1. And the other thing you need to know about R is that everything you do to decrease the reproductive rate is cumulative. So if 60% of the population wears, masks, then that has a certain level of effect. If 80%, it has a greater effect, and it just keeps building. And then you throw in effective contact tracing. These things keep adding up, and the lower we get the R, the faster these cases go down. So it's really kind of it's kind of like our scorecard. It's not just, it's the case numbers that we see, but also this R value. But that has a lot to do with the various strategies that are employed. And keep in mind, our officials, the mayor and the city council, they don't want to restrict activities as any more than they have to. We have to keep this R down. So if we keep the R down through less intrusive measures, it means we can lessen up on some of the other restrictions and get our economy back. So some people think that these two are like inversely related or something. They're really not. The better we do controlling this, the more we're able to start resume opening up. So it's really something that that's why we keep pushing the mask wearing, social distancing, the hand washing, all these protective measures, because every one of them, each person doing their part lowers this R value as a community, and it's kind of our scorecard. So that's primer on the R value.
Well, that is really great information, and it's why we always enjoy hearing from you, our medical director for the Health Department of Flagler County, and there's more questions that you'll be responding throughout the discussion today. Next, I wanted to recognize our Advent Health Palm Coast Chief Operating Officer, Wally D'Aquino, is on the line. He's calling in remotely. And I wanted Wally to first and foremost present an update on the hospital system. What's the status in regards to COVID, and anything else you want to share? And again, you'll be participating in the Q&A that will come shortly after our presentations.
Sure. Good afternoon, Mary Melissa. It is a pleasure for us from Advent Health to be able to be here and share information with our community that we feel it's important. The current status for our hospital is the word is steady. The good news is that we're not seeing any significant increase in COVID hospitalization for the past 10 days, I would say. But we continue to have a steady hospitalization number for the past 10 days. So in other words, it's not increasing, but it's not decreasing as well. Although, as you heard from Bob earlier, that visits to the ED as it relates to COVID has decreased a little bit. For the past 2 days, we have noticed a little increase. But that means that the acuity of patients showing up with COVID maintains the same, where they need to be hospitalized. We're also experiencing for the past 5 days or so, members of our community showing up in the ED a little too late with other health issues. So we encourage everyone, if you are having any other symptoms unrelated to COVID, please come to the emergency room so we can take care of you. Those numbers have changed for the past few days, like I said, and we are seeing an increase of patients that could have been taken care of earlier. I connected with our medical director from the emergency room this morning, and he confirmed that many of the patients that we're seeing for the past few days could have been in a less acuity situation if they were seeking help earlier. So I invite all of our community not to wait. Even if it takes a phone call with your primary care or an urgent care, please take the necessary steps to take care of your health and allow us to help you. Yeah. Some important information for our community. I would like to remind everybody, if they are seeking COVID testing, but they are not experiencing any symptoms, so asymptomatic, you are encouraged to seek testing, but not in the emergency room. That is not the correct location to seek COVID testing. We need to be taking care of people that are symptomatic, sick, and therefore this is better for you as well, because patients here will be waiting a little longer if we have too many people showing up for testing. Bob Snyder just described the many locations and the wonderful work that's being done through our community with churches working together with the health department. This shows how connected our community is and how dedicated we are to defeat this virus. And I encourage people to take the time, if you don't have any symptoms, or if you feel that you've been exposed to other members of our community that were tested positive, I encourage you to get tested, but in the emergency room only if you're symptomatic. We do get a lot of questions about our elective procedures. We continue to do so. We do test every single patient that is going through any elective procedure to maintain the safety for the patients and for our staff as well. But I want to assure the community that we continue to monitor all of the levels within our hospital on the daily basis to make sure that we have the capacity, and currently we are able to continue this, which is good news for our community. And that's the latest from our local hospital.
That's great, Wally. Thank you for your continued leadership, and we certainly appreciate your partnership as well. And now we're going to turn it over to our fire chief, Palm Coast Fire Department Chief Forte. I hear we have a couple different issues that could be percolating out in the other waters that we want to ensure our residents. Obviously, we had mentioned previous that we have taken into consideration dealing with COVID, some of the alterations when it comes to sheltering in place and those sorts of things. But if you can just start off with your update as well. You've got a team that's been part of the COVID response that are trained to do that, and so take it over.
First, thank you for having me here again. It's good to be back and reviewing what we've been working on and how quickly we lose track of time. here we're going into August, and we were thinking way back in March that we'd be done with this by June and moving forward, but the long haul we're here for, and we're preparing for the next 12 months if it's going to take that long, and our operation is moving forward with understanding how that's going to occur. First, our team, Captain Asconi's been working with county on continuing the relationship that we've got and developing further plans for the long term. Most recently, in this past July, we increased our gross decon of all the stations. We are doing it weekly. And I think between the mask wearing and the deconning of the buildings and sanitizing the trucks and the handles that we're doing on a regular basis, it's keeping that cross-contamination down dramatically, and we're seeing success on that. The PPE effectiveness is working in the stations. We've only had one employee that was out with COVID in the time since March up until now, and he's just returning to work now. And we anticipate the numbers could jump, but if we keep diligently working on deconning our processes, I think we'll keep that number very low. We started localized training with personnel. It's kind of hard to do deconning at the same time that we're doing confined space training. Kind of an oxymoron. So we are actually developing our own training that we're doing these tight quarter drills that we need to do every year while maintaining social distancing and the deconning that needs to go along with it. And when we started doing that, and the crews are responding well to the training that we're doing. August, we're going to go back into the community for home safety inspections, because the longer we stay away from the seniors and their ability to change the batteries and check on their home, we're going to start to see the call volumes go back up. Right now, we're seeing about 28 calls per day, generally speaking, and about 80 to 90% of those calls are coming in requiring us to be more cognizant of PPE. It's just a safety awareness, and when we get those calls, there's a high likelihood that there's a COVID in the house, or it's been acknowledged that there was COVID in the house. So we're continually working around that. And we're also working with our partners in Parks and Rec. Most recently, we had the opportunity to work with them and the Child Sports Alliance. So the kids that are out in the community, that we want to reinforce our commitment to get the games going and keep things open, but do it in a safe and responsible manner. Both Captain Asconi and I were on a conference call with them on Monday and figured out what it is that they're going to need help with enforcing on their end, so that they have already developed wonderful plans to open up, but we want to figure out what we can do to help them to enforce the plans that they put in place. So we're working with them and putting out a draft for them to disseminate to their students and their players and families on how that they can operate safely in the community, so that the kids can start having something more normal to go into, while the families can watch, but watch safely from a distance. And we're relying a lot on the family support to enforce those plans that were put in place to make it a success. We do have the hurricane that's out in the Caribbean, Eastern Caribbean. The models showed 4 days ago that it was near Bermuda. 2 days ago, it showed it was near the eastern side of the Florida coast. Today, it's showing it's further out in the western side of the Florida coast in the Gulf. And we're expecting it to move further west as time goes on. So it's a good way that we can start cleaning out the cobwebs and making sure that we're doing what we're doing, but we're ready to ramp up a second emergency management team to handle both the COVID and the hurricane season as well. We're looking at Friday having another meeting, both with all the executives and the department teams. And then Sunday might see some wind or rain from the effect, but I don't believe we're going to get the onslaught of a major hurricane or a Category 1 that looks ominous when you start looking at the cone of trail that the hurricanes would bring. This is going to be a wind event, kind of like a nor'easter that we would see in March coming out of the Georgia or the Atlantic area. But that's our update for now.
Yeah, and so if you've not done your preparedness kit yet, though, right? We still want to make sure that our residents are truly prepared.
Absolutely. First and foremost, if you don't have a hurricane kit together, if you've got medications, important papers like your insurance papers, your driver's license, birth certificates, marriage certificates, anything that you would need to start your whole entire life over, you need to have that all organized and in a place. What folks are doing now is they're scanning everything and they're keeping it on a thumb drive, or they're putting it in their cloud, or they're putting it somewhere that they can have a copy of it. But just envision that your normal life cycle will completely be uprooted and having to start over, and what documents will you need to move forward. If you're home, you need several days of food and water just to make sure that you're going to sustain yourself, because if we do get a bad storm, there's no telling when we're going to get to your house if you need help. And just getting to the store could be a challenge. So we want to remind everybody to look at the disaster guide. They can go to the flaglercounty.org site and look up the disaster guide there and get the information. And just take a look at where they live and how the storm would affect them. Anybody who lives in what would be the Palm Harbor or the C section and F section, there's Zone B. If they call for an evacuation of Zone B, those folks would be evacuated. Zone C would be the Woodlands area. Zone D would be closer to the interstate on the western side of Florida Park Drive, but you'd have to really know where you're at, what you're located at, and take the direction of emergency management when it's time to go.
Right. Be prepared. And last but not least, we are going to hear from our city manager, Matt Morton, on the city update.
Well, thank you. I'll keep it really brief. I think most things have been discussed, but if you go to palmcoastconnect.com or our virtual city hall, our wildfire tab has been replaced, and it is now our hurricane information tab. You can, in fact, download the disaster preparedness guide there and view it, and also up-to-the-date storm information. As Chief Forte said, I can't believe we had our first hurricane EOC meeting this morning, and part of what we do is go through what we call a go, no-go checklist. You know, are we prepared? Are we thinking of all those little things that start leading into management and planning of a storm? And so I would encourage you to do that at home, as we've all mentioned, as you mentioned, Mayor and Chief, you mentioned. Start going through your go, no-go list and take a look. As far as why we're here today and COVID-19, we continue to work very hard on workforce and resource management. Again, this is this scenario we talked about early on through this crisis of preserving resources, ensuring that we can adequately respond to every emergency, whether you've injured yourself at home or are having a medical emergency or a COVID emergency. And that can't matter if there's a hurricane or a tropical storm or making sure that our resources are adequate and up to date. We've done a phenomenal job. A lot of gratitude to the fire department on planning for that long haul and planning for this very scenario, getting ourselves ready. And so that goes around our resources, our workforce, and just making sure that we remain ready. I think a lot of questions we're getting right now, specifically to the city operation and related to COVID, both revolve around the CARES Act, which I see some questions here, so I'll wait for those today. But another one's City Hall. When is the City Hall going to reopen? And as Captain Asconi has reminded us on these town hall meetings and in EOC meetings, we're delivering services through our virtual town hall and Palm Coast Connect right now at an extraordinarily high level. About 97% of our services are uninterrupted, and will continue to do so. We actually expect an extension. I don't know that for a fact, but we're hearing an extension of the governor's order will come out today or tomorrow, giving another 30 days on the resumption of in-person meetings. So what I'm getting is, now that I have this opportunity to speak, I believe that City Hall will remain as it is today through the month of August, with not being open to the public. So the community wing closed, and we continue to deliver all of our services virtually. And so there is that expectation I want to begin to communicate, because I think that will be our reality moving forward. We went through our entire, as Jerry was mentioning, we met with Parks the other day at the fire station, and we've been going through the departments, reevaluating, reassessing all of our current operational and strategic plans. And I think we're in a good position now, and we will just continue to monitor and support our departments, and more importantly, support our community as we can each day.
Great. Thank you for that update. So we are going to dive into some questions now, and not a surprise, but one of the early questions that we received obviously is surrounding masks. As mentioned, Bob, about the city's adopted resolutions mandating masks, was adopted, and we do take this very seriously. We understand the impact and hopefully the result it will have if there is compliance, and we are seeing that. I know I've been to Publix a few times, and I've certainly seen way more of our residents putting on the masks as they step inside, which is encouraging. It sends the message that our residents are really taking this equally as seriously and care about their neighbors.
Right.
And so one of the questions really around mandating masks in stores and other public places and in outdoor spaces where socially distancing is not practical. You know what our resolution had stated. I know the county had adopted, a request as well. I know some of the corporate stores, the chains, are adopting a practice and a mandate. Can you speak to that a little bit, and then maybe talk a little bit about the outdoor compared to the indoor?
Yeah, it seems like the big box stores and more institutions and business places, as you mentioned, are mandating as company policy. Target, Walmart, Walgreens, these are just recent examples, and so they're mandating this, and it's part of their policy. Even Planet Fitness and some of the gyms, I think August 1st, it's going to be mandated by Planet Fitness. So, and more folks are being added to the roles of mask wearers as time goes on. So we truly believe, and Dr. Bickle, I know you agree, that facial coverings is probably the #1 public measure, as Jerry mentioned, that can really have an impact on keeping that R value below 1 and keep decreasing. You agree?
I agree, and it's cumulative. The more people who do it, the better.
Yes.
And again, I think when it came time to reopen the parks and the trails and the encouragement of again, sort of those youth activities with the safety precautions, there is that balance there that we want to make sure that socialization, safe socialization is occurring, because this has been a very stressful time for many. And so, if you're able to go for a walk or be outside and get some fresh air, that's what we're also encouraging, but doing it, obviously, the smaller events, that still applies with the phase the governor's in as well. Is it still under 50?
We're still looking at under 50
Okay.
in gathering groups, and if you can, while you're in those groups, to keep everybody 6 feet apart.
Okay, and so those are measures that are required.
And outdoors is much better than indoors. Because outdoors, getting fresh air, being outside, there's a greater chance of social distancing occurring, but when that's not the case, we should be donning a mask. But so especially indoors, that's what the main concern is.
And I know that the health department had partnered with our fire department in an effort to distribute masks.
Yes.
So can you talk a little bit about what's been distributed and how well that went?
36 cases?
More than that, my friend. Remember, you came to the health department and we loaded it. 67,000 masks in total were provided to members of our community here in Palm Coast in short order, and a main fire station was the primary site for weeks for people to go and grab a mask and keep their family and themselves safe. So thank you, Chief,
Always
so
our pleasure.
much for that.
And if I can kind of plug the volunteer organization a little bit. Yeah. When the order came in, we met on a Friday. By Monday, Captain Wilsey had set up the entire schedule, worked with our senior staff, which would be our associate members. They were staffing the station, probably had a constant flow the first week, and were constantly handing out the masks in groups of 3 to 5. It was a very good success, and it's what these folks love to do. They want to participate. They've basically been put on a shelf for 5 months while this is going on, and this was their first opportunity to come back in and help the community to hand out the mask and feel like they were part of the organization again. So for that, we appreciate the partnership. We handed out a tremendous amount of masks, and we see them all over the place. So it was a great opportunity.
And if am I to understand that perhaps you may be able to get some more masks?
67,000 masks arrived yesterday, and half the boxes are in my office. So,
great.
And so, yes, we are going to be partnering with you again to make sure these masks get distributed.
So the point is, I mean, again, if you're going out and you have to go out and you can't socially distance, or if you're going inside, and even if you're able to socially distance, wear the mask. It makes a huge difference.
Yes.
And now you can go pick it up at one of our fire stations, meet some of our great first responders as well, but do it
We'll
safely.
hand them out again.
Yes. And then another question, since we're on the topic of masks, and I'm just going to put this to the whole panel. It really just goes to the fact of if people are and do have health conditions, and if they are have some type of condition that a mask would impede their health and safety, that is sort of an issue that we've said, if you do have some sort of health, situation, correct? Like you think, I mean, that has to be appropriate for those that have some type of a respiratory or something like that?
Yeah, absolutely. And
Okay.
so I think the best advice there is do your best to stay indoors and to quarantine at home. Don't take any risks, especially if you have underlying conditions, as the mayor had mentioned. Do stay home and just be very careful.
Just as a point, when you've got a mask on, you're still breathing. It's just a restricted airflow. You're breathing 100% room air, which is 21% oxygen. Nothing's changed, but they should at least feel if they can try to put a mask on, they should put a mask on, go out in public to do what they need to get done. If they need to step away, they can go to an area and remove the mask to catch a breath. But we understand that there are underlying conditions with asthma and things like that. But these things have to be exasperated and they have to kick in. Some folks have had lung issues and breathing issues. We understand that. But for their protection and for everybody else's, if they could put it on for as long as they can stand it, it's a good opportunity for them to at least try to protect themselves.
So Wally, I'm going to pose this question to you. How is Advent Health prepared to handle COVID cases in Flagler County? And second to that, can you just talk about your process in the hospital? I know for visitors and there's a lot of restrictions even with entrances and everything else. So can you really explain that process and how that works and why?
Sure. To answer the first question in terms of how are we prepared, we are way better prepared than we were back in March. We had the opportunity now to continue to focus on this, on PPEs, on equipment, on any necessary changes that we had to do in the building, and even cross-training throughout 3 months now, right? It's been a while that we've been dealing with this virus. Now, the processes that we had to put in place is obviously to increase the safety for our staff and our community, patients and visitors. So today, if you come to our hospital, you will be required, number one, to wear a mask. We will provide a mask if you don't have one, but we are going to ask you to wear the proper mask also. Bandanas are not allowed in the hospital. If you don't have a mask, it's better than nothing, but it is proven that it doesn't cover as much as a mask. So we're all going to take temperatures of all visitors and all the patients. We're all going to go through a screening questionnaire. And then depending on the results of the questions, we will take you inside the hospital to a different process. But visitors that are screened positive, they are not going to allow to come into the hospital to visit. This is to protect their loved ones and themselves, and again, our staff. And also, in the topic of masks, we obviously are requiring masks inside our facility for the past few months. We do have patients that cannot wear a mask because of underlying conditions. But the majority obviously can wear a mask. And we're not only asking our staff, our team members to wear a mask, we are also requiring patients to wear a mask as long as there's somebody else in the room. So when they're by themselves inside the room, obviously they do not have to wear a mask. But as soon as somebody's coming in, we are asking patients to wear a mask also. And it works. I'm going to give the community an example. We had a patient that arrived here, asymptomatic, and came to the hospital for a different complaint. A few days later, started showing symptoms. Well, we were treating that patient already, but we were following all the proper protocols, including both the patient and staff wearing a mask. After we tested the patient right away, after they were showing symptoms, they showed to be positive with COVID. The good story about this, not one staff that was taking care of that patient became positive with COVID. Why? Because of hygiene, wearing a mask, and hygiene, washing their hands, and both patient and staff wearing the mask. So it does work.
That is absolutely spot on. Really appreciate that. And just as a quick aside, how are all the healthcare workers doing? This has been a marathon, as the chief indicated, much longer than what we anticipated. You know, your teams must at times be not only overwhelmed but exhausted. How are they doing?
Yes, the team is working hard for the past 3 or 4 months, since March, working hard, endlessly, long hours, double shifts. But they are resilient. And I'm extremely thankful for the team that we have. And when we say team, it's not just nurses and physicians. As you can imagine, there's a lot of other team members here taking care of patients, from cleaning the rooms all the way up to making the food for everybody. But I also want to take the opportunity, Mary Melissa, to not only thank our staff, but also thank all of the healthcare workers within our county. I mean, we have the health department staff working for so many weeks with testing. We have the first responders putting themselves out there, nursing homes and assisted living and memory centers doing an incredible job controlling so we don't have an outbreak here. So we have a lot of people in our community dedicating their lives and risking their lives for the good of our community. And we're extremely thankful for each one of them.
I agree. Thank you for that, and please make sure you send our best wishes from the community as we continue to offer that as well. I'm going to shift gears just a bit, and really there's been several questions obviously around public health that are geared much towards yourself, Bob, and Dr. Bickle to respond to. So did you want to take some of those questions and either respond yourself or throw them to Dr. Bickle?
Yeah, sure. I'll take one here, and Dr. Bickle can definitely follow up. Question is, has Palm Coast had any hot spots, or are the cases random? So we are tracking very carefully for any outbreaks, in particular in congregate care facility settings, or maybe in a zip code area. Naturally, the larger zip codes in Palm Coast would have the larger cases, but nothing has surfaced yet that indicates a major outbreak. However, Steve Harris with the IT department here and City of Palm Coast, and Matt and Melissa, you're aware of it, and Jerry as well. We have worked with them, our health department team, Gretchen Smith, and we're sharing lots of information and data about cases, where are they located, and we're able to map and to identify where those hot spots might be. And so this is just recently developed. So going forward, we'd love to share that with the community so that precautions can be taken if there is a hot spot or an outbreak. But we are prepared in case there is one. We have formed nursing strike teams of outsiders, including our own team and our own public health department, to respond quickly to case investigate, test in that area, a church or a community spot close by where testing will occur so that we can isolate those who are impacted and then begin that very important contact tracing function. So we have a plan and we are prepared in the event there is a hot spot or an outbreak. So we have the tools to monitor it very carefully.
Yeah, and I think that's important to note. It's about that partnership. And Matt, if you want to update on the wastewater testing and where we are, because I think that would, if you guys can really both speak to the overlay of the maps, especially in light of our schools, our assisted living facilities, some of the higher risk contained areas that, may develop into something that we want to make sure we're monitoring, and we want to get ahead of it. And so, Matt, if you want to update the committee.
Yeah, so
on that.
I think we're going to have some really great information to share as soon as this week. We have the base maps, as Bob mentioned, with it's a heat mapping system done by zip code. We have overlaid not only the physical locations of schools and education facilities, but also the district draw boundaries. So if you live in a certain area and you would draw students from a geographical boundary so people can begin to understand how it impacts certain areas of the city. I'm very happy to report that we have our testing samplers in place, and our first wastewater samples were pulled and are in. The test they should be at the facility now and being tested. Those results will be back very shortly. So this week, I'm hoping, if not, it's going to be first thing next week, we'll have our first comprehensive overlay map with our current zip code data, our health and education facilities, and our wastewater testing data. So now we really have that first, as we mentioned, tactical look from many angles, what it means, where the hotspots are, and how people can start using, and the professionals in the community can start using that information to just be better informed about how and where COVID is tracking within our community.
And Dr. Bickle, if you want to really add why that's important, I know this has been something you've been looking into, reading a lot about. You're very well informed as the wastewater testing sort of has transformed aspects of how you can be proactive in certain areas, certainly in the epidemiology world. And so if you can speak to that, I think that would be really important.
Sure. There are basically two issues that we're trying to address with this strategy. One is that, unfortunately, we're not there right now. We were there in March and April, where when the case counts are really low and not enough people are getting tested, you can be missing these early pockets of infection that are starting. But with wastewater testing, you can pick these up, identify neighborhoods of where there's cases before people even know it. Or before you even identify the case. That was first found in Europe. Unfortunately, we're beyond that right now, but we could get back there hopefully soon. And secondly, it's just another measure of what's going on in the community, the activity level that could be used to target basically massive testing efforts, where we find a neighborhood or a community center or a school or something that overlays. That's why you guys are putting those maps together that might be the source of this increased levels that we're picking up in the wastewater, and then we can go in there and do a massive testing program. And that may become even more useful if and when, and hopefully it's soon, rapid testing capability becomes much more widespread, because then the biggest problem is that if you look at the cases identified in Flagler, the estimates are, we're what, 800 now?
850.
Okay, the estimate is in general that we're probably have actually had 10 times that number.
Yeah.
You just haven't picked all these people. That's just kind of around the nation. So assume we've had 8,000, we haven't picked them up. If we could be, and part of it's because people are asymptomatic during part of their illness, or some people have mild symptoms. If we can find these spots and then test, extensively, we can start interrupting the transmission earlier than we're doing now. That's the biggest challenge, and that's a big issue with why this disease is so hard to control, is because so much spread happens before people are symptomatic, which is also why masks are such a big part of this equation.
And Melissa, it's also why we felt it was important to plan over a month ago, enhancing and increasing the number of community testing sites from 1 to now 6, but that also does not leave out now the urgent care centers, the Centricare facilities, the AZA Health, our federally qualified health center on the Parkway, our MediQuicks, our other urgent care centers, some doctors' offices, they're doing testing as well. So it's a little army of testers that we have going on here in the county and Palm Coast.
So important, again, to really understand,
exactly.
Who has it and who does not. And so a couple questions around city business. I'm going to ask our city manager to respond about Palm Coast resuming enforcing parking regulations. If you could take that question on, Matt, and then if you can take the following question about Palm Coast Connect and the facial recognition, logging into your account. We know that question was posed previous, and you have an update on that as well.
Absolutely. So first question is, when will Palm Coast resume enforcing park regulations? We are. In emergent circumstances or great need, we've never stopped. We had discussed that we had reprioritized a lot of our resources at some times for either cleaning and sanitation, operational, or community, functions through this emergency. For a while, we had a nighttime park patrol from our code enforcement because we were seeing an uptick in vandalism, which thankfully has now waned. So more or less code enforcement is back, but we're also working with our community right now. We recognize the hard times everyone is in, but we've always been communicative. We've always been proactive, but also work with our residents. So short answer, it's ongoing. If you have an issue, please go ahead and let us know. You can do that through creating a case. It's the best way at Palm Coast Connect. Then you'll know that it's been received, and you'll see the status updates and tracking. There's also always the code enforcement number, and we will continue to enforce all of our regulations that frankly are our health, safety, and quality of life issues here in the community. As far as the facial recognition, so what that gets to be very clear is, well, I have my phone in front of me, and I might try to log into an app. I'm not actually, but you can simply hold your phone up, and Face ID pops up. And so those, I'm going to probably get everything wrong, but from what our tech wizards tell me, Blake in IT, who's one of our programmers, they are setting up a user wireframe interface. I hope I got that right. Doug, hopefully you can nod. Looks like I'm close. And so, yes, we understand the value in that. Right now, we have a wraparound app in the App Store. So you go into Palm Coast Connect, you have almost all the functionality. We have been in the process of writing and coding and developing our own true, fully functional app. In that, we will absolutely look into having for both Android and Apple that face technology. So you have your account, you logged in, your password's saved, and just like everyone else nowadays, I don't know half my passwords because my phone knows my face. That's simple. You're in, and you're about doing your business with Palm Coast Connect. And if people are listening, we've also expanded that capability through Alexa and some other things that are going online. So we continue to adapt. That's again one of these great things about our Palm Coast Connect platform and the technology. It's so adaptable. It's so agile. It's easy to have a Alexa integration. I saw a sample yesterday where we literally said the address, what's my garbage pickup, and that familiar Alexa voice is telling me when my garbage is going to be picked up, what time and what day of the week. So back to the point, face recognition is coming. We've heard that from the community. We want to continue to make things easy to use, user-friendly, and for their primary purpose, which is for this continued engagement so we can hear from our residents and do a better job. So thank you for whoever asked that question.
I was going to say thank you to the resident who asked that question. That's really a great, not only encouraging idea, but it's one we've taken and now move forward with. Shifting gears a little bit, we have heard a lot about schools. As far as what's going to happen, what the plan is. Bob, I know you've been engaged in that process as part of the planning and stakeholder process. Can you speak to the question, obviously, is what are we doing to keep our children safe in school? I do understand face-to-face connection is important. And then about when the schools will be reopening, when, again, returning to school. Will it be mandatory for students in high school to wear masks?
Sure. I really had a wonderful opportunity to serve on the reopening of Flagler Schools task force. Our new superintendent, Kathy Middlestead, and Dr. Earl Johnson, David Bosserdead, and their team, I think, did an excellent job in coming up with a plan that, as you said, did involve public health comments and did address facial coverings. But I tell you what I really liked about the plan is that it gives moms and dads options, a traditional option and then 2 options for remote learning. And that's really important because moms and dads who have to work and have to keep the family supported in that way, they can send their children to school, but then those moms and dads who can arrange for virtual learning, they can as well. So it would set up this situation where it's maybe less students, and I think about 20% to 30% have chosen the options 2 and 3, the virtual learning options, so it's less children physically at school to allow for greater social distancing and other measures that are important. And then the other thing about the facial coverings is it is required in school when social distancing cannot be practiced. You know, whether that's in the classroom, but think about it, when students and teachers move from classroom to classroom, they're in transition between classes or to recess or to the lunchroom for lunch. You know, there's congregation in the hallways and corridors, so that's where facial coverings come into play and are just so, so important. So that was definitely addressed in the plan. So thank you to the task force for that. And then regarding, do we have a plan to respond to an outbreak? As I mentioned earlier, we certainly do. The plan's been developed by our Director of Nurses, by our School Health Coordinator, Stephanie Ears, and Lynette Schott and her team, the Student Services team at the school. Basically, it's reflective of what happens if there's a flu outbreak, you know, and then we stress great importance then on case investigation, identifying those who need to be isolated. Well, the same thing would happen with COVID-19, and then there would be a greater enhanced contact tracing effort where we would then identify those individuals who are exposed so that they can too be isolated and be provided guidance by our public health team and our nurses. So a plan is in place and we do know what to do. And so we look forward to school starting. I believe it's been delayed now to August 24th. And so it allows us a little bit more time to prepare as well.
Everything getting started. And that's a great update on that. I know we've had a very diverse set of questions today, and we're approaching you know, the closing of our town hall. So as always, I'd like to give the opportunity to our team to really give some just closing remarks, just an emphasis on what you feel is important for our residents to hear this week. We'll be continuing these town halls again, certainly next week as well with future updates. So please stay tuned in to submit your questions again as we continue to actually have that response ready for them. So Bob, if you wanted to give sort of a closing statement that you feel was really important for our residents.
Thank you, Mayor. So everyone, you know, I regret that that we have to still share some sobering statistics with respect to the transmission of the virus and its impact on all of us. However, I was really glad to be able to talk about two hopeful indicators that are trending in the right direction, and it was mentioned by Dr. Bickle and backed up by Wally as well. So to me, that gives me encouragement, and it also says, hey, you know, as a community, right? Takes a village, that with all of us together taking part in embracing concepts like facial coverings, mask wearing, especially when indoors, it is going to make a difference. The science, the research, and the studies that have been peer-reviewed have shown this. So that is the #1 tool that we have in our toolbox. So thank you all for complying. Keep up the great work.
Thank you so much. Dr. Bickle, anything to add to that?
Yeah, this is kind of a mixed message. So we're doing better with getting the R down and getting the spread down. It looks like Flagler County's plateaued and Florida's coming down. There's sort of two groups of people kind of been resistant to masks. One is the people think it's a, you know, imposition on their freedom. But the other group is kind of this group I call sort of COVID minimizers. People think it's not so bad, and they kind of use every little piece of data to support that. And one of these pieces was the death rate wasn't going to be so bad this surge, because it was going to be younger people infected, so that even though the case number is going up, the death rate wasn't going to go up. Well, that turned out to be wrong. And yesterday, I think we set an all-time record in Florida. All the experts predicted this, but so for those of you who think this isn't a serious infection, keep in mind Flagler County, our local hospital, is as full with COVID patients as it's ever been. Levels like about 10 times what they were a couple months ago, and the death rate in Florida is as high as it's ever been. So this is a serious situation we're in. We are making some progress, but there's no reason for relaxing our vigil.
Thank you. A very sobering comment, but definitely needed. Wally, any closing statements from Advent?
Yes, I would like to invite our community to continue to wear their masks, not only for themselves, for their loved ones, and for our healthcare workers as well. By doing so, we continue to control the surge, at least in our community. And also remember, if anybody's feeling any symptoms, do not delay your treatment or your visit with your own physician or urgent care or the hospital. Take your health serious. Allow us to help you at the right time.
Thank you so much. Chief?
Well, just briefly, just be cognizant of what's happening, either with the COVID or with hurricanes, or who knows what else is coming down the pipe for us. We're prepared for whatever we need to deal with. We've got great teams in place. Just be cognizant of everything and know the situational awareness around you. And if you have any questions, call your city, call 911. We're here for anybody who needs their help.
Thank you. Matt Morton.
Again, thanks for everyone for tuning in. Really grateful to have this opportunity, and just please continue to remain engaged with us. Again, the virtual town hall on Palm Coast Connect has all the up-to-date information. Again, as we mentioned early on, if you hadn't joined us by then, the hurricane tab is up. You can download the hurricane guide. You can still track all the current COVID information, all the mask information. We continue to work across this county with all of our partners to do the best we can, and we've really appreciated the community support and participation in these efforts to keep ourselves, our neighbors, and our loved ones safe and healthy.
Absolutely. And thank you to our residents, again, who continue not only to tune in, who've continued to ask unbelievably well thought out questions that are important to our community as a whole. Thank you to our continued partners that provide that information, that are working so hard day and night to respond and keep our community safe. And again, to the residents that have complied with what we've requested every single step of the way. You've truly been extraordinary partners. We look forward to providing some current information next week. So please submit those questions. Please stay safe. Please wear your mask. Wash your hands. Socially distance. Stay inside if you have to. And we will get through this together.